NCLEX RN Practice Exams. Subject: Physiological Integrity. Module: Basic Care and Comfort. Chapter: The nurse is caring for an elderly woman who has had a fractured hip repaired. In the first few days following the surgical repair, which of the following nursing measures will best facilitate the resumption of activities for this client? A. Arranging for the wheelchair. B. Asking her family to visit. C. Assisting her to sit out of bed in a chair could. D. Encouraging the use of an overhead trapeze. The answer is D. Encouraging the use of an overhead trapeze. Exercise is important to keep the joints and muscles functioning and to prevent secondary complications. Using the overhead trapeze prevents hazards of immobility by permitting movement in bed and strengthening of the upper extremities in preparation for ambulation. Sitting in a wheelchair would require too great hip flexion initially. Asking her family to visit would not facilitate the resumption of activities. Sitting in a chair would cause too much hip flexion. The client initially needs to be in a low Fowler's position or taking a few steps, as ordered, with the aid of a walker. The most important nursing order for a client with major head trauma who is about to receive bolus enteral feeding is: A. Measure intake and output. B. Check albumin level. C. Monitor glucose levels. D. Increase enteral feeding. The answer is A. Measure intake and output. A. It is important to measure intake and output, which should equal B. Enteral feeding are hyperosmotic agents pulling fluid from cells into vascular bed. C. Water given before feeding will present a hyperosmotic diuresis. D. Input and output measures assess fluid balance. The pathological process causing esophageal varices is: A. Ascites and edema. B. Systemic hypertension. C. Portal hypertension. D. Dilated veins and varicosities. The answer is C. Portal hypertension. Esophageal varices results from increased portal hypertension. In portal hypertension, the liver cannot accept all of the fluid from the portal vein. The excess fluid will backflow to the vessels with lesser pressure, such as esophageal veins or rectal veins, causing esophageal varices or hemorrhoids. Which of the following interventions will help lessen the effect of GERD, acid reflux? A. Elevate the head of the bed on 4 to 6 inch blocks. B. Lie down after eating. C. Increase fluid intake just before bedtime. D. Wear girdle. The answer is A. Elevate the head of the bed on 4 to 6 inch blocks. Elevation of the head of the bed allows gravity to assist in decreasing the backflow of acid into the esophagus. Fluid does not flow uphill. The other three options all increase fluid backflow into the esophagus through position or increasing abdominal pressure. What is the main benefit of therapeutic massages is: A. To help a person with swollen legs to decrease the fluid retention. B. To help a person with duodenal ulcers feel better. C. To help damaged tissue in a diabetic to heal. D. To improve circulation and muscles tone. The answer is D. To improve circulation and muscles tone. Particularly in the elderly adults, therapeutic massage will help improve circulation and muscle tone as well as the personal attention and social interaction that a good massage provides. A massage is contraindicated in any condition where massage to damaged tissue can dislodge a blood clot. Which of the following foods should be avoided by clients who are prone to develop heartburn as a result of gastroesophageal reflux disease, GERD? A. Lettuce. B. Eggs. C. Chocolate. D. Butterscotch. The answer is C. Chocolate. Ingestion of chocolate can reduce lower esophageal sphincter, LES, pressure leading to reflux and clinical symptoms of GERD. All of the other foods do not affect lay pressure. Which of the following should be included in a plan of care for a client receiving total parenteral nutrition, TPN? A. Withhold medications while the TPN is infusing. B. Change TPN solution every 24 hours. C. Flush the TPN line with water prior to initiating nutritional support. D. Keep client on complete bed rest during TPN therapy. The answer is B. Change TPN solution every 24 hours. TPN solutions should be changed every 24 hours in order to prevent bacterial overgrowth due to hypertonicity of the solution. Option 1 is incorrect. Medication therapy can continue during TPN therapy. Option 3 is incorrect. Flushing is not required because the initiation of TPN does not require a client to remain on bed rest during therapy. However, other clinical conditions of the client may affect mobility issues and warrant the client's being on bed rest. Which of the following should be included in a plan of care for a client who is lactose intolerant? A. Remove all dairy products from the diet. B. Frozen yogurt can be included in the diet. C. Drink small amounts of milk on an empty stomach. D. Spread out selection of dairy products throughout the day. The answer is B. Frozen yogurt can be included in the diet. Clients who are lactose intolerant can digest frozen yogurt. Yogurt products are formed by bacterial action, and this action assists in the digestion of lactose. The freezing process further stops bacterial action so that limited lactase activity remains. Option 1 is incorrect. Elimination of all dairy products can lead to significant clinical deficiencies of other nutrients. Option 3 is incorrect because drinking milk on an empty stomach can exacerbate clinical symptoms. Drinking milk with a meal may benefit the client because other foods, especially fat, may decrease transit time and allow for increased lactase activity. Option 4 is incorrect because although individual tolerance should be acknowledged, spreading out the use of known dairy products will usually exacerbate clinical symptoms. Pain tolerance in an elderly patient with cancer would A. Stay the same. B. Be lowered. C. Be increased. D. No effect on pain tolerance. The answer is B. Be lowered. There is potential for a lowered pain tolerance to exist with diminished adaptive capacity. What is the main advantage of cutaneous stimulation in managing pain? A. Costs less. B. Restricts movement and decreases. C. Gives client control over pain syndrome. D. Allows the family to care for the patient at home. The answer is C. Gives client control over pain syndrome. Cutaneous stimulation allows the patient to have control over his pain and allows him to be in his own environment. Cutaneous stimulation increases movement and decreases pain. The nurse is instructing a 65-year-old female client diagnosed with osteoporosis. The most important instruction regarding exercise would be to A. Exercise doing weight-bearing activities. B. Exercise to reduce weight. C. Avoid exercise activities that increase the risk of fracture. D. Exercise to strengthen muscles and thereby protect bones. The answer is A. Exercise doing weight-bearing activities. Weight-bearing exercises are beneficial in the treatment of osteoporosis. Although loss of bone cannot be substantially reversed, further loss can be greatly reduced if the client includes weight-bearing exercises along with estrogen replacement and calcium supplements in their treatment protocol. A client in a long-term care facility complains of pain. The nurse collects data about the client's pain. The first step in pain assessment is for the nurse to A. Have the client identify coping methods. B. Get the description of the location and intensity of the pain. C. Accept the client's report of pain. D. Determine the client's status of pain. The answer is C. Accept the client's report of pain. Although all of the options above are correct, the first and most important piece of information in this client's pain assessment is what the client is telling you about the pain. The client's report. Which statement best describes the effects of immobility in children? A. Immobility prevents the progression of language and fine motor development. B. Immobility in children has similar physical effects to those found in adults. C. Children are more susceptible to the effects of immobility than are adults. D. Children are likely to have prolonged immobility with subsequent complications. The answer is B. Immobility in children has similar physical effects to those found in adults. Care of the immobile child includes efforts to prevent complications of muscle atrophy, contractures, skin breakdown, decreased metabolism and bone demineralization. Secondary alterations also occur in the cardiovascular, respiratory and renal systems. Similar effects and alterations occur in adults. After a myocardial infarction, a client is placed on a sodium-restricted diet. When the nurse is teaching the client about the diet, which meal plan would be the most appropriate to suggest? A 3 ounces broiled fish, 1 baked potato, ½ cup canned beets, 1 orange, and milk. B. 3 ounces canned salmon, fresh broccoli, 1 biscuit, tea, and 1 apple. C. A bologna sandwich, fresh eggplant, 2 ounces fresh fruit, tea, and apple juice. D. 3 ounces turkey, 1 fresh sweet potato, ½ cup fresh green beans, milk, and 1 orange. The answer is D. 3 ounces turkey, 1 fresh sweet potato, ½ cup fresh green beans, milk, and 1 orange. Canned fish and vegetables and cured meats are high in sodium. This meal does not contain any canned fish and/or vegetables or cured meats. A nurse is assessing several clients in a long-term healthcare facility. Which client is at highest risk for development of decubitus ulcers? A. A 79-year-old malnourished client on bed rest. B. An obese client who uses a wheelchair. C. An incontinent client who has had 3 diarrhea stools. D. An 80-year-old ambulatory diabetic client. The answer is A. A 79-year-old malnourished client on bed rest. Weighing significantly less than ideal body weight increases the number and surface area of bony prominences which are susceptible to pressure ulcers. Thus, malnutrition is a major risk factor for decubitus, due in part to poor hydration and inadequate protein intake. Mrs. Kennedy had a CVA, cerebrovascular accident, and has severe right-sided weakness. She has been taught to walk with a cane. The nurse is evaluating her use of the cane prior to discharge. Which of the following reflects correct use of the cane? A. Holding the cane in her left hand, Mrs. Kennedy moves the cane forward first, then her right leg, and finally her left leg. B. Holding the cane in her right hand, Mrs. Kennedy moves the cane forward first, then her left leg, and finally her right leg. C. Holding the cane in her right hand, Mrs. Kennedy moves the cane and her right leg forward, then moves her left leg forward. D. Holding the cane in her left hand, Mrs. Kennedy moves the cane and her left leg forward, then moves her right leg forward. The answer is A. Holding the cane in her left hand, Mrs. Kennedy moves the cane forward first, then her right leg, and finally her left leg. When a person with weakness on one side uses a cane, there should always be 2 points of contact with the floor. When Mrs. Kennedy moves the cane forward, she has both feet on the floor, providing stability. As she moves the weak leg, the cane and the strong leg provide support. Finally, the cane, which is even with the weak leg, provides stability while she moves the strong leg. She should not hold the cane with her weak arm. The use of the cane requires arm strength to ensure that the cane provides adequate stability when standing on the weak leg. The cane should be held in the left hand, the hand opposite the affected leg. If Mrs. Kennedy moved the cane and her strong foot at the same time, she would be left standing on her weak leg at one point. This would be unstable at best, at worst, impossible. The nurse is instructing a woman in a low-fat, high-fiber diet. Which of the following food choices, if selected by the client, indicate an understanding of a low-fat, high-fiber diet? A. Tuna salad sandwich on whole wheat bread. B. Vegetable soup made with vegetable stock, carrots, celery, and legumes served with toasted oat bread. C. Chef's salad with hard-boiled eggs and fat-free dressing. D. Broiled chicken stuffed with chopped apples and walnuts. The answer is B. Vegetable soup made with vegetable stock, carrots, celery, and legumes served with toasted oat bread. Mayonnaise in tuna salad is high in fat. The whole wheat bread has some fiber. This choice shows a low-fat soup, which would have been higher in fat if made with chicken or beef stock, and high-fiber bread and soup contents, both the vegetables and the legumes. Salad is high in fiber, but hard-boiled eggs are high in fat. There is some fiber in the apples and walnuts. The walnuts are high in fat, as is the chicken. An 85-year-old male patient has been bedridden for 2 weeks. Which of the following complaints by the patient indicates to the nurse that he is developing a complication of immobility? A. Stiffness of the right ankle joint. B. Soreness of the gums. C. Short-term memory loss. D. Decreased appetite. The answer is A. Stiffness of the right ankle joint. Stiffness of a joint may indicate the beginning of a contracture and or early muscle atrophy. Soreness of the gums is not related to immobility. Short-term memory loss is not related to immobility. Decreased appetite is unlikely to be related to immobility. An 11-month-old infant is brought to the pediatric clinic. The nurse suspects that the child has iron deficiency anemia. Because iron deficiency anemia is suspected, which of the following is the most important information to obtain from the infant's parents? A. Normal dietary intake. B. Relevant socio-cultural, economic, and educational background of the family. C. Any evidence of blood in the stools. D. A history of maternal anemia during pregnancy. The answer is A. Normal dietary intake. Iron deficiency anemia occurs commonly in children 6 to 24 months of age. For the first 4 to 5 months of infancy, iron stores laid down for the baby during pregnancy are adequate. When fetal iron stores are depleted, supplemental dietary iron needs to be supplied to meet the infant's rapid growth needs. Iron deficiency may occur in the infant who drinks mostly milk, which contains no iron, and does not receive adequate dietary iron or supplemental iron. Daily dietary intake is much more related to the diagnosis of iron deficiency anemia than is sociocultural, economic, and educational background of the family. Iron deficiency anemia in an infant is very unlikely to be related to gastrointestinal bleeding. Anemia during pregnancy is unlikely to be the cause of the infant's iron deficiency anemia. Fetal iron stores are drawn from the mother even if she is anemic. A 46-year-old female with chronic constipation is assessed by the nurse for a bowel training regimen. Which factor indicates further information is needed by the nurse? A. The client's dietary habits include foods high in bulk. B. The client's fluid intake is between 2,500 to 3,000 milliliters per day. C. The client engages in moderate exercise each day. D. The client's bowel habits were not discussed. The answer is D. The client's bowel habits were not discussed. Foods high in bulk are appropriate. Exercise should be a part of a bowel training regimen. To assess the client for a bowel training program, the factors causing the bowel alteration should be assessed. A routine for bowel elimination should be based on the client's previous bowel habits and alterations in bowel habits that have occurred because of illness or trauma. The client and the family should assist in the planning of the program, which should include foods high in bulk, adequate exercise, and fluid intake of 2,500 to 3,000 milliliters. A patient with lung cancer is admitted to the ER for crackles in the lungs, sudden onset of confusion, and decreased urine output. Which of the following lab results is consistent with this complication? A. Urine-specific gravity of 1.035. B. Na plus 151. C. K plus 3.5. D. Low ADH levels. The answer is A. Urine-specific gravity of 1.035. A high serum sodium and low ADH levels are symptoms of diabetes insipidus, which are the opposite of this complication. See it. Low potassium is not a sign of either. The nurse collects a urine sample from a patient with urolithiasis. The nurse knows that urolithiasis is the presence of dash stuck in the genitourinary system. A. Stones. B. Blood. C. Bile. D. None. The answer is A. Stones. Stones. Kidney stones can occur at any point in the genitourinary system and is known as urolithiasis. The nurse in the outpatient clinic reviews the history of the client recently diagnosed with essential hypertension. The nurse is most concerned if the client states which of the following? A. I eat 1 orange and 1 banana every day. B. I take vitamin B and C and mineral supplements daily. C. I jog 2 miles 3 times per week. D. I consume 3 cocktails every night. The answer is D. I consume 3 cocktails every night. Alcohol is a huge risk factor for essential hypertension. The nurse cares for a client who suffered a severe eye injury related to an acid splash. The nurse administers proparacaine hydrochloride, ophthane, before each eye examination. It is most important for the nurse to take which of the following actions? A. Measure the client's intraocular pressure. B. Instruct the client not to rub the eye. C. Inform the client that effects of the medication last about 30 minutes. D. Instruct the client about the action of the drug. The answer is B. Instruct the client not to rub the eye. Rubbing the eye could cause further injury because the medication numbs the eye. The patient would not know he is causing himself injury. A patient has just been admitted to the ER following a motor vehicle accident, was lying on his back face towards the sky. Describe the positioning of this patient with the most specific term. A. Decerebrate. B. Lateral. C. Decorticate. D. Supine. The answer is C. Decorticate. The patient is in a supine position, but more specifically they are in decorticate position, which indicates damage to the cerebral hemispheres. A client with jaundice is experiencing pruritus. Which nursing intervention would be included in the care plan for the client? A. Applying pressure when giving him injections. B. Keeping the client's fingernails short. C. Administering vitamin K subcutaneously. D. Eliminating the client's dietary protein intake. The answer is B. Keeping the client's fingernails short. Keeping the client's fingernails short will prevent him from scratching himself and injuring his skin. Pruritus is itching. Which of the following statements apply to the proper use of a cane? Select that does not apply. A. A client's cane length is equal to the distance between the elbow and the floor. B. For maximum support when walking, the client places the cane forward 15 to 25 centimeters, 6 to 10 inches, keeping body weight on both legs. The weaker leg is moved forward to the cane so body weight is divided between the cane and the stronger leg. C. The client needs to learn that 2 points of support such as both feet or one foot and the cane need to be present at all times. D. Canes provide less support than a walker and are less stable. The answer is A. A client's cane length is equal to the distance between the elbow and the floor. A person's cane length is equal to the distance between the greater trochanter and the floor. The nurse cares for a patient with myasthenia gravis. Which of the following is a symptom that is not typically part of the disease? A. Shuffling gait. B. Muscle weakness. C. Ptosis. D. Diplopia. The answer is A. Shuffling gait. Shuffling gait is always typical of Parkinson's, not myasthenia gravis. Spironolactone, aldactone, is prescribed for a client with chronic cirrhosis and ascites. The nurse should monitor the client for which of the following medication-related side effects? A. Jaundice. B. Hyperkalemia. C. Bradycardia. D. Constipation. The answer is B. Hyperkalemia. Hyperkalemia is possible because spironolactone is a potassium-sparing diuretic. Encourage the client to avoid high-potassium foods. A patient with glaucoma asks the nurse what he can do to improve his vision. The nurse knows that A. Vision loss from glaucoma is irreparable once present. B. Vision loss from glaucoma will heal itself over time. C. Vision loss from glaucoma can be helped with daily medication. D. Vision loss from glaucoma can be corrected with glasses. The answer is A. Vision loss from glaucoma is irreparable once present. Vision from glaucoma cannot be fixed, only stabilized. A male patient has the following lab values: arterial HCO3 of 25, hemoglobin of 15.5, phosphate of 1.5, calcium of 8.0, TSH of 2.9. Which of the above is a critical result and must be reported to the physician immediately? A. HCO3. B. Calcium. C. Phosphate. D. Hemoglobin. The answer is C. Phosphate. Phosphate is normally between 3 to 4.5, so this lab value is out of range. A nurse is reviewing the laboratory test results for all 4 of her diabetic clients. Which of the following result reported indicates poor diabetic control? Glycated hemoglobin, the 1C, levels are A. 0.025, B. 0.04, C. 0.06, D. 0.08. The answer is D. 0.08. A good A1C is between 4 to 6%. Higher numbers indicate poor diabetic control. A 16-year-old client was brought to the emergency department after a vehicular accident. The client's blood pressure is 105/58 of a millimeter of mercury, and further physical assessment reveals a ruptured spleen. With all this information, the nurse should assess the client for an early sign of decreased arterial pressure, such as A. Disorientation and lethargy, B. Increased temperature, C. Wide pulse pressure, D. Decreased peripheral pulse. The answer is D. Decreased peripheral pulse. This is a reflection of decreased cardiac output and a decreased arterial pressure resulting from hypovolemia. A patient at the outpatient clinic describes leg pain that occurs while walking and is relieved with rest. The patient asks why this happens to him. The nurse knows that the pain is related to A. Heart failure, B. Arterial insufficiency, C. Venous insufficiency, D. Angina. The answer is B. Arterial insufficiency. This pain only occurs in arterial insufficiency and is known as intermittent claudication. A patient has been admitted with symptoms of BPH. Which of the following complaints, if observed by the nurse, requires follow-up? A. WBCs in urine, B. Nocturia, C. Hesitancy in urinary flow, D. Elevated PSA. The answer is A. WBCs in urine. Hesitancy in urinary flow, nocturia, and elevated PSA are normal for a patient who has BPH. WBCs in urine, however, indicate an infection like a UTI. A patient post-Billroth-2 asks the nurse how to prevent dumping syndrome. Which advice, given by the nurse to the patient, would be considered correct? A. When you eat, eat small meals. B. Don't lie down after eating or everything will come back up. C. I would avoid whole wheats and other dense foods. Those are too rough for your stomach right now. D. Drink water with your food to help digest it. The answer is A. When you eat, eat small meals. Whole wheats and dense foods will take longer to digest and move, which is good for patients with dumping syndrome. Lying down after eating is recommended for dumping syndrome, as well as eating small meals and drinking water separate from meals. A nurse is teaching a patient with type 1 diabetes about measures to prevent long-term complications of the disease. The nurse should include which of the following instructions? A. Wear slippers when hanging out around the house. B. Avoid wearing insulated boots in cold weather. C. Wear shoes made of artificial fibers. D. Wear knee-high nylons instead of pantyhose. The answer is A. Wear slippers when hanging out around the house. Slippers will protect the feet, which might get cut/bruised/banged and the patient wouldn't know due to diabetic neuropathy. Shoes should be made of natural fibers and knee-high nylons should never be worn. A nurse working on a neurology unit cares for a patient diagnosed with CVA. The patient is experiencing difficulty in talking but can understand everything the nurse says. The nurse suspects damage to what part of the patient's brain? A. Broca's area. B. Frontal lobe. C. Wernicke's area. D. parietal lobe. The answer is A. Broca's area. Listening/processing/understanding words occurs in Wernicke's area while speaking occurs in Broca's area. If the patient cannot speak, damage must be in Broca's. The home care nurse visits a patient 2 days after cataract extraction and implant. Which of the following statements, if made by the patient, requires further teaching? A. I know I will have to have my husband lift anything heavier than 5 pounds for the next week. B. I will call the doctor if I feel nauseous. C. My eye itches a little bit. I think that means it's healing. D. I know I am not allowed to shampoo my hair for 1 week. The answer is D. I know I am not allowed to shampoo my hair for 1 week. The patient is allowed to shampoo their hair, but they must lean their head back instead of forward to avoid increasing intraocular pressure.